So I'm going to talk to you about whitening, and if you're interested in that, so just want to walk you through what that looks like. So what we would do for that is we'll take impressions, upper and lower impressions. That way it's custom just for your mouth. We'll make some rubbery trays for you. They're really soft and flexible. Go back to about the first molar. So that's what's in your smile line. And then you'll put the gel that we will send home with you, and that percentage is going to vary based on if you have any sensitivity, things like that. So we'll address that and figure out what's best for you. And then you're going to have 2 bulk syringes in your kit to start with. And at the end, there's a little cap. You just twist it off, and it can actually be the cap that goes on after you're done. And then you're just going to put the gel in the spaces that face out, kind of your gum line area. So you just like a little dot all the way through. Okay. And then if this was your mouth, and this is where that tray goes, you would put it on. And then I always recommend kind of pressing the gel kind of into the tooth across all the way through. Take a tissue and wipe that, and then another tissue, so you don't just wiping the gel into the tissue, wipe it again so that it's clean, and then you just wear it. Based on the percentage that you would get, the time would vary with that. So some patients prefer to wear them overnight, so we would get the percentage that makes sense for that. Some prefer to just wear it 15 minutes or so a day. But you're going to whiten every day for 14 days. It's important to do that because it conditions your teeth and gets them as bright as possible. So we'll get a start shade today, and we'll see where you are after that 14 days. During that time, you want to avoid anything that could stain a white t-shirt so that we can get the best optimum whitening for you. Once you enroll in the whitening, you'll pay the initial startup fee for the whitening, and then after that, every 6 months that you come in and have your exam with the doctor and your hygiene visit, you get a complimentary vial of the whitening. So that just keeps you able to touch up. You shouldn't ever have to do that 14-day window again. It's more of just maybe 3-4 days in a row, family pictures or a big event coming up to get you back to that whitening. Okay. Everyone varies with whitening, so it just depends on how many things you have that in your diet that could stain a white t-shirt like we talked about before. So again, avoiding those while you're whitening, and then you just might have more touch-ups if you are someone who has a lot of coffee, tea, smoking, red wine, things like that. We're going to send you home with some directions as well. You're going to want to, before you put the trays in, brush and floss really well. Okay. And then go ahead and you can load that tray like we showed. Go ahead and put them in and kind of push them against the teeth as we showed, and then just wearing them. And then when you're done, you're going to want to remove those trays, rinse your mouth, and you can brush away any remaining gel. All right, sounds good. And always use lukewarm water or cool water. You don't want to use hot because those are real thin, kind of rubbery material, so it could melt them. Oh, wow.